Hello, everybody. Thank you so much for joining us. My name is Daniel, and here's my name sign. Today's Library Lunch and Learn for the Library Service of the Deaf and Hard of Hearing is this is our series called Library Lunch and Learn, which we do L3 is the sign for that, Lunch and Learn. So today we have a presenter with us today. Their name is Hayley, last name is McLemore. And Hayley is with National Deaf Therapies, and she'll be presenting today talking about depression and mental health screenings. So Hayley will go ahead and discuss a little bit about those topics. Before we go ahead and start Hayley's presentation today, we are going to have a poll that we give to our audience. And please understand that this poll is going to be at the end of the presentation. We have some announcements before Hayley presents. And then after the presentation, we will also have some announcements before ending. When Hayley is done with her presentation, then you guys in the audience are more than welcome to ask any questions to Hayley that may be needed. You can raise your hand or type in the chat. And Hayley will go ahead and do her very best to try and monitor and respond to y'all's questions. So please be patient with us as we are doing this for the first time ourselves. So, all right, so now I'll hand it over to Hayley for her presentation. Awesome, Hayley. Hello, everyone, and thank you guys so much for having me here today. Here is my screen that I am sharing with y'all today. Thank you so much, Daniel, for introducing me. But today I'm going to be focusing on understanding what depression is, what depression looks like, and the importance of mental health screening, and what mental health screening looks like as well. So if anyone has any questions or comments, feel free to type them in the chat, or you're more than welcome to turn on your screen, and I'm happy to go ahead and answer your questions as much as I can. So really, the importance of why this matters. Depression impacts 280 million people all over the world. Many people suffer from depression. And I care about this work because I've seen how important recognizing the signs of depression and what it looks like, how that can provide support to individuals and really change lives as soon as possible once we recognize the signs. So I'm wondering if y'all can type in the chat yes or no, but is there any one of y'all yourself who personally have depression or you know somebody who struggles with depression? Thank you, Shelby, for participating. Anyone else? All right, yeah. So thank you guys so much for participating. I'm going to transition. If y'all want to continue to be active in the chat, feel free to go ahead and do so, and I'll move on with my slides. So what is depression? What does depression look like? It's a medical condition. It's not just sadness. Sure, sadness is one symptom of depression, but there's also many other symptoms of depression. It affects your mind and your body both. The DSM, which is the diagnosis book that is used for mental health diagnoses, that says where a person is experiencing long-lasting mood, loss of interest, things that they used to enjoy, along with changes in their sleep. When depression hits, it's hard to get out of the house. It's hard to get out of the bed sometimes. People's interests go down. Sometimes it'll change a person's sleep patterns. They either sleep too much or they're not sleeping enough. Energy and appetite can change. Focus can diminish, meaning that person who's depressed might be easily distracted or has a hard time focusing, or they feel like they have limited self-worth as well. For example, if this happened for at least 2 weeks or more than 2 weeks, and it affects multiple areas of your life, work, relationships, families, friends, that can mean that you have depression. There's different symptoms of what depression looks like. And as I mentioned before, depression is not just sadness. There's many symptoms of what it looks like. There's physical symptoms such as affecting your sleep, impacting your appetite. Maybe a person who's depressed wouldn't eat enough or eats too much. Chronic fatigue. They could have gotten a well-rested night of sleep, but still feel tired throughout the day. Emotions could be sadness, guilt, or maybe just feel empty. I feel they might feel that they have no purpose for their life. For cognitive side effects, it might look like it might be trouble, the person might have trouble focusing, or they feel overwhelmed, or they feel hopeless. And behavior might be impacted by withdrawing from activities, withdrawing from being around friends and community. There'll be friends that you could call and they don't answer, or someone might miss work and their work would call them and they wouldn't show up. They withdraw from activity, withdraw from exercise, or might stay in the bed and do and spend way too much time at home. There's different types of depression that we can see this list here, and it does range. Some people might have MDD, major depressive disorder. Some folks might have persistent depression disorder, which means that it lasts longer than 6 months at a time. Some people might have seasonal affectiveness disorder, which means that it typically impacts them around the winter months when it becomes dark earlier outside and we have less sun and we live just with darkness longer. And it's hard to adjust to the seasonal change because it's so dark and because we lack so much sun during that time. There's also postpartum depression. Oftentimes, parents who have children really struggle with dealing with that after birth and the impacts that bringing a baby into this world can impact someone. And then lastly, we also have bipolar depression. So, and that's also when moods can really vary. You can be manic to depressed and deal with lots of mood swings. So as we can see here, there's many different kinds of depression. So there are some examples of myths that I want to talk about today. Some people will say, oh, hey, depression's just in your head, move on. Or they'll say only adults are impacted by depression, excuse me. And it's just not true. It's not just in someone's head. It truly is a chemical imbalance that affects people emotionally and physically. Some people will just say, hey, move on from this. This isn't important. Don't dwell in this. You're fine. And that's really a hurtful statement. It's dismissive as well. And it doesn't just affect adults, it affects children and teenagers as well. Depression doesn't have any specific group in which it focuses on. Depression can really impact anyone. So here's some examples on if we don't screen for depression, if we don't treat depression, what could it look like? So if we don't screen or if we don't help or treat, suicide rates have the ability to increase. And in the workplace, it would impact drastically. If people are untreated and not depressed, they oftentimes won't show up to work, which can not only affect the business, but it affects somebody's personal financial life. So this really affects many people. It affects how we sleep. It affects if we don't eat enough. It affects our weight. It affects our activity levels. And depression can not only cause emotional issues, but physical health issues. So that is the cost of not treating depression. So oftentimes there's a lot of folks when they're depressed, there's a stigma from other folks about depression. Someone might think, hey, knock that off. This is just in your head. you're fine. And this stigma can come up in a lot of different types in a lot of communities. Amongst different races, there's stigma against depression. Some cultures and races believe that depression's not real, and that can create barriers for people who are depressed to get help. And then they don't gain access to screening for depression and then treating depression. So really, here's an important quote that I want to share with you. Untreated depression can be deadly, but it also is highly treatable. It is the key to early detection. Early intervention can truly save lives once depression is treated. These are just some different ways that this impacts individuals as a whole. Relationships can be strained. Parenting and caregivers could be impacted, meaning, for example, I myself am a parent. If myself, I'm a parent and I have children, it could potentially uh, it could impact the way that I treat my children and take care of my kiddos. Social isolation is another toll on this. Isolating from friends, family, and withdrawing from people as a whole. That would impact my ability to have support, my ability to be stable. Obviously, we know that there are many different barriers to this. I see this in my work so much. I see so many barriers to care, and that's a huge issue that we're facing. Lack of resources is one huge barrier. Misconceptions about mental health, racism, fear, stigma, and generalizations, people not feeling heard or seen or believed. In my work, I notice that oftentimes in rural areas, those folks are not gaining access. And there's some states who don't even have adequate insurances for people to get the care that they need. So we see a lot of barriers to provide the treatment and screening necessary for those who really need it. So why screening is important? There's really two screenings that are standardized and most often used. So the reason why these screenings are important is because early detection truly helps us identify and figure out easy referrals and resources to provide to our patients. And it's something that is very fast once it's screened, and it's highly confidential as well. Oftentimes, when we go to the doctor, we just get our physical or a checkup appointment, or we go to an urgent care. And it's just easy to get a screening there. It's very easy and fast. And everyone who goes to get a physical would get a screening for depression as well, especially those who are at high risk capacities, meaning postpartum, teenagers, older communities, and those who really struggle with chronic illness and really deal with a lot of trauma in their life and trauma survivors. So as I mentioned, there's two screenings. So if you score positive on the PHPV, then you would get to the second one, which is PHQF. So those are more in-depth screenings that show what you would struggle with and the support that you need. So after the screening is finished, that doesn't mean you're all done. If you score positive on the screening, then that's great. That means that we can start providing the resources needed, referrals to therapy, and to get the help that you need. Maybe that would be going to another doctor that you need more support for. And we're able to link patients to other screenings, like screenings for high blood pressure or for diabetes. And all of these can be linked and related together. So I just want to spotlight high-risk groups. It's really important that we understand the groups that are most often impacted on this, and we don't miss out on providing the support that they need. Teens and young adults are at the highest risk. After that is postpartum parents, as I mentioned, older adults, veterans, and trauma survivors, and marginalized groups such as deaf and hard of hearing folks, BIPOC folks, LGBTQ, the LGBTQ and queer communities. Those are marginalized groups that oftentimes get missed for screening, but may need more mental health support. So what can we do? What are some good tools and resources that you can give to your friends, family, or those in the community? You can talk to your primary care provider. If you don't have a primary care provider, there's many community clinics that you could access care in. You could even screen yourself online just to make sure you're using a credible website such as Mental Health of America. That organization, they have an online screening where you can see what you struggle with. Be an advocate for yourself, be an advocate for your family, be an advocate in your workplace. Really advocate for yourself. If you really feel like you need help, ask us, ask for help, ask folks in your community. And I know that there will be help given for you. Oftentimes, asking, hey, are you okay, can be really powerful, that someone would feel recognized and seen. But not only is that impactful, it provides a chance for us to educate folks on screening and get the help that they need. It's a powerful tool to really help folks with what they need and get them referred to the care that they need to be supported. Here's some online resources. There's the crisis line 988. You can text or call 988. And then there's also another crisis line 741 741. You can see this here on the PowerPoint as well. Some cities and states have their own crisis hotline that you could call or text into. So check about your local area. And if you need help finding those resources, please contact me directly, and I am happy to help you find resources in your local community. So how can you help others, or how can you help yourself? Ask someone, hey, are you okay? How can I help you? Encourage folks to get screened for depression. Understand the importance and the first steps to getting help. And be open about your mental health. Talk about it. If we can remove the stigma about talking about mental health, more people will feel comfortable talking about how their mental health impacts their daily lives. So really, how can we recognize and empower ourselves and others? Screening, period, saves lives. It's important for us to know what depression is, what it looks like. And really, us knowing can be the bridge to our friends, to our kids, to our parents, to our community. We can be that bridge by empowering ourselves with knowledge. As I mentioned, 280 million people have depression. This is a serious condition, but it is treatable. As we mentioned, screening or encouraging other folks to get screened, be involved in your local community events and advocacy. All right. So really, we're at the end. I can give you my email. Daniel, I sent him my email. And so Daniel is also able to send out my email and personal information to y'all. So I'm going to summarize my presentation really quick. But does anyone have any questions about depression, mental health, or the screening process in general? Let me stop sharing my screen so we can see the audience. This is Daniel. Does anyone have any questions for Hayley? And Hayley's saying any comments, you can leave any comments right in the chat, or you're more than welcome to turn your screen on, or again, type in the chat, or come off mute and voice, and the interpreter can sign for you. So yeah, we're happy to have our interpreter voice for you, or excuse me, sign for you if you wanted to use your voice to ask a question. Or you're more than welcome to sign and the interpreter can voice for you as well. All right, well, I'll go ahead with a question that I have. So really, I was reading a book. It was a very wonderful book. It was called, let me find the name of it here. It's called Learning the Language of Depression. And that was by the Depression Project. This book was so wonderful. It talked about what depression looks like. It talked about how people say, specific phrases that might be common if they are depressed. And especially for somebody who is experiencing depression themselves, it talks about how they might express themselves and how they could improve their communication with their families, with their friends, co-workers, and throughout the community. And not only that, it also gave other perspectives about how others can respond to a person who is experiencing depression and how they can support. So there's many phrases in that book that I thought was incredibly helpful for me. And I just thought it was a wonderful book. I wanted to mention that. And Haley's saying, I think that's great. Yeah, I think that that's an incredible book, not only for anyone to read, but also people's families as well to read. And Brenda's saying, I do have a question as well. Let me spotlight you, Brenda. Yeah, I was just wondering if you had any sort of training on how to prevent depression or like what trainings have you had that have talked about that topic? And Haley's saying, yeah. So as far as trainings, let me back up a little bit. I should have mentioned earlier, I am a certified therapist myself for National Death Therapies. I'm a licensed clinical social worker and I've been licensed, I am licensed in the US nationwide. And so obviously I did get a degree in social work and I've had loads of training and have worked with many mental health providers and really have worked with many clients as well who have struggled with depression. So, one thing I've learned is sometimes depression isn't always just, uh, you know, one symptom. Someone has a hard time getting out of bed or their mood is affected. Sometimes people will say or not say something uh, to identify that they have depression. Really, there's a lot of depression that goes unseen that could be told through body language or behavior. But a lot of depression goes unseen as well. And Brenda's saying, I do have another question for you. I am curious, if depression is higher for people who themselves have different hearing levels. Do you know anything about that amongst the deaf and hard of hearing communities? Yeah, yes and no. So really it does vary. There's many different reasons that someone would have depression, whether it be genetic, environmental, there's many different reasons. We've seen folks who are late deafened adults that have been more prone to depression because they were used to being hearing, and then as they adjusted to being late deafened, that was a huge change, life-changing for them. So some folks who are hard of hearing that try and fit into the hearing world or don't feel necessarily totally hearing or totally deaf, it can really depend on the environment, how much support that person got growing up, and also what they're faced with in their daily lives. And Brenda's saying, I do have one more question for you. If there's a person who experiences language depression or experiences isolation, are they more prone to depression? And Haley's saying yes. Well, truly, this is case by case. As far as language depression, we've seen people with language deprivation thrive in their daily lives. Um, and might be able to get support later in life. But really, this is case by case. What kind of exposure do people have to these resources? So really, it's just what kind of resources and what support someone has. So Brenna's saying, okay, yeah. So once someone finds out that they have depression, then you're able to recommend them for screening and further testing and also therapy. and then refer them to any further care that they're needed. And Haley's saying, yeah, at times that does happen. At times a doctor will see any client or patient at their office. They would screen them there. And maybe they would say yes, that they have depression. They would try and provide help. Maybe they would be referred to me for therapy, and I would screen them for my documentation. And then we would have an ongoing conversation discussing about their depression, what's going on. And then I could set up a diagnosis from the information that's given to me. And so either we can continue with therapy, or if they need medical intervention, I can also refer them to a psychiatrist to get the medication they need. And Brenda's saying, thank you so much for this wonderful presentation that you had with us today. And thank you so much for coming today. So really, now that we're at the end, I'm going to go ahead and send out your contact information, your email. And really, now we just want to give the floor to the audience if there's any questions that anyone has. All right. All right. And so if there's nothing in the chat and no questions, I guess I guess this is the end of our conversation. You've done really good, Haley. So if anyone has questions, they're always welcome to email us and we can forward the email to Haley. So I do want to give some announcements before we end our presentation. We have a library lunch and learn. Every month we do this. It's the third Wednesday of the month. And so the start time is at noon and we go till around 12:45. Next month, I have our flyer that has, typically we post our flyer on Facebook, and it's for the Library Services for the Deaf and Hard of Hearing Facebook group, and that's where we post all of our announcements and flyers that you're able to click on the Zoom link and join automatically. And this is what our flyer looks like. Next month, let me show you this again. You can see our presenter. Next month, we will have Dr. Angela Scruggs with us. Angela Scruggs herself is a licensed therapist and counselor. And she also herself is a certified sign language interpreter here in Nashville. So really, her topic is to break barriers and build long-lasting connections in mental health for the deaf community. So I think that that's going to be a great topic for us to discuss as well. Everyone is welcome to join us next month for our next Lunch and Learn. And the second announcement that I have for y'all today is we have this event coming up. It's a family event. It's a silent family movie night that we will be hosting. And the movie that we're going to be watching is No Special Hero. And then we're also going to be watching Super Deafy as well. By June Macer. It's a popular actress, a deaf actress who is really good. This movie is great for all ages. There's going to be two different locations that we have this event. One location, or excuse me, one event is going to be November 1st, and that's going to be at 3 to 5 p.m. And that's going to be at the Pruitt branch. And we're going to post that on Facebook as well. And then the second one, the second location that we have is going to be on November 10th, and that's going to be at 4 to 6 p.m. And that's going to be at the Goodlettsville branch. So those two branches will be hosting this family silent movie night. So please go ahead and RSVP and sign up for that event. And then we also will be providing drinks and popcorn. And then a third announcement that we have for y'all today is the Walk for Hearing 2025. So this event is on November 8th. It's at 9. Registration is at 9. And then we start walking. There's going to be at 9:30 a presentation, and at 10:45 is when we will start walking to support HLA, the Hearing Loss Association of America. So really, we can make a difference if we band together. If we come together as a state and a community, we can support those who are deaf, hard of hearing, and deafblind. So here's another flyer that we have. Lastly, we have this. This is a book, Journey Jaunt's Journey. And we can see the author here, Monique D. Johnson. She wrote this book, and it's a very cool book. She herself is a deaf educator, a professional that uses American Sign Language. And she's going to be coming to the Hermitage branch at the library on November 25th at 6 to 7:30 p.m. So y'all are more than welcome to sign up for that event as well. All right. Well, I guess we are going to do our poll now. So we'll send our poll out to our audience. So we do have some poll questions for y'all. You're more than welcome to give feedback about what topics you'd like to hear. Any future programs you might be interested in us offering, please feel free to put that down. Any feedback you have for us, or really anything that you'd like to see us improve upon. You know, sometimes we can't read y'all's minds, so we need to know. All right. Well, if you can't answer it, that's all right. You're more than welcome to take the poll later. You're more than welcome to email us. All right, y'all. Well, I do think that we will go ahead and wrap up today's Lunch and Learn. All right, wonderful. Well, that concludes today's meeting. We've done the poll and our announcements. And so really, we just want to say thank you guys so much. And thank you so much, Hayley, for your willingness to come here and present to us and telling us about depression and mental health screening. So thank you so much. Yeah, no problem. Thank you for having me. I'm so happy to be here. Oh my gosh, absolutely no problem. And thank you so much to our audience for being here today and joining us. I hope to see all of you guys at our further events and our next Lunch and Learn. We're looking forward to it. All right, thanks everyone.